Today I'm going to be putting an IV in and administering fluids. Before I enter the patient's room, I want to check their chart, make sure the IV solution matches the MAR and the medical record, and check the patient chart to see if they have any allergies as well. After I have all of my equipment gathered, I'll knock on the patient's door, perform hand hygiene, walk in. Hi, my name is Julia. I'm going to be taking care of you today. We're just going to be putting an IV in and giving you some fluids. Before we begin, have you been having any pain today? 0 being no pain at all, 10 being the worst pain you've ever felt. Perfect. And then I'll check their ID badge for patient's name and date of birth. Make sure that matches the solution as well in the MAR. And then after I've done that, I can begin to set up everything that I need. I want to make sure I raise the bed to a proper level, put a pad underneath the patient's arm to help with any excess fluids, make sure they're placed in low Fowler's position, and when I'm inserting the IV as well, I'll make sure that their arm is up below their heart. So now I can begin. First thing I want to do is perform hand hygiene one more time and put on my clean gloves. And then I want to set up their J-tube. So I'll take the cap off the syringe here, grab their J-tube, making sure it's unclamped. I'm going to take my alcohol prep pad, clean the site where I'm going to be inserting the syringe. And I will twist my syringe on. I'm going to flush it to make sure that there's no air inside the tubing. All right. Since I've assessed the tubing to make sure that there is no leaking and that it is flush, there's no air bubbles, I can set this off to the side for now, and I will begin to prep the patient. So the first thing I want to do is put on the tourniquet to palpate which vein that I want to use in order for the insertion of the catheter. All right, find my vein, make sure that the vein is straight, not too curved. Since I found a palpable vein, I can release the tourniquet and begin prepping the arm for inserting the catheter. So I want to make sure I clean it with my chlorhexidine. So I will clamp it or unclamp it, clean the site. I'll let this dry for about 30 seconds or longer if it needs. And I can prepare. Now that the site is all dry, I can apply my tourniquet again. Take the cap off of my needle. And when I'm inserting this needle, I want to make sure the bevel's up. I'm going at a 10 to 15 degree angle. And I'm holding the skin taut. All right, now that I have that in, I see my blood return. I will take out the needle, put on the safety, put that in my sharps container, And then I can begin to put on my tubing. So this has a cap on it, meaning that it is already sterile. Take my cap off. And since I just touched it again, I will actually take another alcohol pad and wipe it off. And then I will insert it in to the catheter. I'm gonna unclamp this. Run my saline through. And then I'll pull back a little bit, make sure I'm getting proper blood flow. Perfect. And then run the rest of the saline through. All right, since that's now done, I'm going to take a piece of my tape, my sterile tape, put this over the catheter insertion so I can stabilize it, and I can prep everything else. All right. Since that's stabilized, I will take off my syringe. Should have taken this tourniquet off as soon as I saw blood flow as well. Make sure this is clamped. Take off my syringe, and then apply another piece of tape on the other side of this tube. Okay. So now that I have that done, I'll take my skin barrier protectant and wipe down the skin again, making sure I go around the site and where I will be putting on the taping. All right, let that dry as well. And then on my dressing, I want to make sure I have the initials, date, and the time. Put this over the insertive site, making sure it is occlusive. Take off my label. I want to place this on the side. I want to make sure that we can clearly see the insertion site and the tubing. All right, now that I have that on, I'll check for infiltration, make sure there's no redness. Like I said, that everything is occlusive as well. Since everything looks good, I can begin to prep my IV solution. So the first thing that I'll do is take out my tubing. I want to use aseptic technique whenever I'm taking this out of the packaging. All right. And then this has a cap on it, so I will take it off. I want to make sure not to touch the insertion site. And then I will stab my back. All right. I got that stabbed, so I can hang it up. Since I have that hung up, I can use my drip chamber and squeeze it. make sure it's about halfway full. And then I can unclamp this, let all the fluid run through, making sure there's no air bubbles or infiltration. I want to also label the tubing with the date and the time. Flicking if I see any air bubbles. Just making sure it runs all the way through. Right. All right. Now that I know it's running all the way through, I will clamp it again. And then I need to use another alcohol pad. Clean the tip of this where it's going to be inserted into our other tubing. Can clean this side as well. Then I can insert it. All right, now that that's in, you can make sure that this is unclamped and that our tubing is unclamped. And with the saline bag as well, I also should have double checked at the beginning to make sure that the color is clear and it's not foggy or anything. Check the expiration date. And like I said, for any infiltration of the bag as well. So with the patient, since I have everything all set to go, I will clean up everything, place them back into their normal position. The bed should be lowered all the way down. I'll be checking this for about 30 minutes afterwards to make sure there's no phlebitis or infiltration like I was saying. And then I'll give the patient their call light, see if they need anything, ask them how their pain is. And then after that, I am all set to go. Thank you so much, Susie. Have a good day.